It's better now to induce, to make you have a baby actually even before the due date.
This doc here is talking about the ARRIVE trial, and there are a few points that I want to make. No, we have not changed what we say, and no, it is not better to make you have a baby before your due date by being induced. The ARRIVE trial actually showed that in low-risk, first-time pregnant individuals, there was a significantly lower rate of cesarean delivery, hypertensive disorders of pregnancy, including preeclampsia, and gestational hypertension if they were induced between 39 weeks and 39 weeks and 4 days. And induction of labor did not result in a significantly increased risk of perinatal death or adverse perinatal outcomes. The study concluded by saying it was reasonable to offer elective induction of labor to low-risk, first-time pregnant individuals at 39 weeks. And even ACOG does not recommend routine induction of labor in these individuals at 39 weeks. SMFM says it's reasonable to offer elective induction of labor at 39 weeks to low-risk first-time pregnant individuals, but they need to meet their criteria that was established in the ARRIVE trial. This doc goes on to say that everything was better when the patients were induced, and this is simply not true. There were some things that were statistically significantly better, like the things I just mentioned before, and then there were some things that did not show statistical significance. The primary outcome was a composite of perinatal death or severe neonatal complications. And this included things such as the need for neonatal respiratory support, HIE or hypoxic ischemic encephalopathy, seizures, infection, meconium aspiration syndrome, birth trauma, and hypotension requiring assistance. That did not reach statistical significance. Sorry, I have trouble saying that. And when considering all the things that were looked at for the pregnant individual compared to, as opposed to the neonate, the only things that reached statistical significance were a decreased rate of cesarean delivery and hypertensive disorders of pregnancy in those that were induced. This doc also said that we are now saying that you should be induced, and this is not accurate. That's not what we're saying. It is still considered an elective induction of labor. Elective. And this doc goes on to say that we are saying that you should be induced, which is not what we are saying at all. The ARRIVE trial did show that there are benefits to being induced in those patients who are low risk, first-time pregnant individuals. That's for sure. However, it's not routinely recommended to be induced at 39 weeks, even in these patients, and the results of the ARRIVE trial have been extrapolated to a lot of other individuals as well who do not meet the criteria that were established in the ARRIVE trial. Shared decision-making is key. The patient does have a say as to whether or not they want to be induced at 39 weeks. It's also important to know that the facility needs to have the resources to accommodate elective inductions at 39 weeks, and not all hospitals have these resources. And finally, there is absolutely nothing wrong with wanting to be induced at 39 weeks. If that's what's best for you and the facility has the resources to do it, then that's what's best for you.